The World Health Organization believes hundreds of people have died of coronavirus in Yemen, with thousands more infected. Yet the official tally is 112 deaths, with just 4 from Houthi areas like here in Ib. This man says they have waited for help since 8 a.m. It's now 3 p.m. People yell at him to stop recording, but he continues. He says he called health lines, security officials, politicians, and no one answered his calls. In the Houthi-controlled north, people are often buried in secret or at night. There are reports that families and gravediggers are warned not to speak of the cause of death. Test results are not released, if they are taken at all. Recording burials has become an act of heroism and defiance.
The intentional suppression of the media coverage from authorities, whether it's in the northern or southern governments, this suppression has very dangerous results. Among them is that the world doesn't know the real numbers of the epidemic.
And international agencies don't have the money to help. The UN says it needs $2.4 billion to cover essential aid in Yemen this year. In a pledging drive last week, it fell $1 billion short of that, meaning the closure of services for half of the country's hospitals and nutrition for 2.5 million starving children gone. This is the price of face masks increased 30-fold, putting them out of reach of most Yemenis and aid groups.
We see that the hospitals are closing the doors. We see that the health care providers, they are passing away. The country is running out of its healthcare providers.
One thing Yemen is not running out of is guns. 5 years into a civil war, it's the one thing traders can rely on, and they've never been more popular.
All the people want now is to support their families, so they look for a job or trade. We have found that selling weapons is a profitable business due to the situation that we were in.
Yemenis feel increasingly abandoned by the international community. They must fend for themselves, even making their own medicine.
We return back to use what our grandfathers used, with herbs such as fenugreek, tamarind and ginger.
Yemen is likely riddled with coronavirus, but this is a country with many ailments. Yemenis have been forced to search for their own cures. Charlotte Bellis, Al Jazeera.